Hello and welcome. My name is Akira, and I'll be in the background to support with Zoom. If you experience any technical difficulties, please type your questions into the Q&A. Live closed captioning will be available. Please click the CC button to enable or disable. Members of the public may submit written comments and questions through the Zoom Q&A box, which will be recorded. Apologies. Let me start over. Members of the public may submit written comments and questions through the Zoom Q&A box, which will be recorded and reviewed by HCI staff. For spoken comments, committee members must raise their hand for Zoom facilitators to call on them to share their comments. Public comment will be taken at a designated time during the meeting. The chair will call on individuals in which their hands were raised. Individuals will be unmuted and have 2 minutes to speak. Finally, as a reminder, all chat messages will be included in today's public meeting record. With that, I'll pass it on to Jacob to get into the meeting agenda.
Morning, everybody, and thank you for joining us today for what is our final convening of this group. And before we begin, I just want to take a moment to express my appreciation. You're going to hear that a lot today from us, but really to all the members of this committee, thank you for your service this year, and for many of you for multiple years well before this. And your expertise has been really, really important to helping us drive forward a number of the things that we've done over the years. And we're going to talk about some of those things today. And in fact, we're going to close out on one of the last things this committee helped us drive forward. But just to say, we will have a time today through our meeting to thank you for all the work you've done, but also to talk about what the future looks like for the data exchange framework. So we're going to talk a little bit about Senate Bill 660 and what's to come in the years ahead for the data exchange framework from that lens. We're going to talk about some policy and procedure amendments that are coming down the pipeline. We're going to talk about impact measurement and how we have been measuring the data exchange framework thus far and what it will look like in the future. And we will close with public comment. We can go to the next slide. So I'm going to introduce our wonderful speakers for today. We have joining us our Chief Deputy Director here at HCI, Scott Chrisman. We have our Deputy Director and Chief Information Officer at HCI, Mike Valley. We're also joined by our wonderful senior consultant, Cindy Barrow, and Rim Cothran. Next slide. So, and we can go one more. We open up all of our public meetings with the vision for our data exchange framework in California. This hasn't changed in several years. And really, the data exchange framework started many years ago with Assembly Bill 133 in 2021, and it was a bold vision to start mandating that we move away from fragmentation of health and social service information exchange. It was occurring, but we wanted to start better integrating it across the state to better serve Californians, to better serve their care, to coordinate their care, and that hasn't changed. And now we look ahead to the future and what Senate Bill 660 brings to us, and we see that there are more tools to enable us to continue to meet this vision here. So it's my pleasure actually to bring on Scott for some opening remarks and to talk about where we're at and to thank the committee. So Scott, if I could, and Kara, if we can bring on the slide, and Scott, if I can bring you on.
Yep. Thank you, Jacob. I appreciate that. And I mean, I'll immediately share the same appreciation that Jacob has expressed to each of you for your participation. Certainly here at HCI as a department, we have a long, a rich history of stakeholder engagement, and so we know how much work is involved, and your commitment is incredibly important and recognized. So really want to start there, and then reflect that way. Jacob lays it out very nicely. I mean, we're essentially at an inflection point in the program. We are very excited about the transition. We're about 4 months in. As you all know, we've been working on this since the summer. And I think it's going, really exceptionally well, thanks to Jacob's leadership. and the team, really becoming part of the HCI portfolio. I think the vision that Jacob shared, the vision for the data exchange framework, is a great fit with our overall mission at HCI around expanding access to healthcare that is equitable, that is high quality healthcare, and that is affordable. And I think the data exchange goals, the vision, and the work being done, speaks to that. And so we're excited. We think it's a great fit, and we'll sort of work through the rest of this transition, and again, kind of move from one phase to the next. It's sort of that, with that appreciation for each of you and the team bringing the program to this point. I think again, tremendous amount of work has been done. I myself look forward to the next phase and being part of that next phase of work, because there's more to do, as you all know. But I think we're well positioned, and look forward to moving forward together. I have to share, we've, interestingly enough, I mean, since we shifted from OSHPD to HCI in 2021, we've taken on a number of new programs that we've been entrusted with by this administration. I have to say that this one sort of speaks to me the most because of my own background in health information exchange. So, I just personally and professionally am thrilled that we're able to be the host department, and look forward to next steps. I'm not going to go into too much in terms of department updates. We'll make that a part of sort of future engagement work. Kind of look to the team. We'll talk about SB 660 again, kind of part of that inflection point. Here we are completing a transition, and then there's a kind of a new set of task or charge for the program. And again, part of that is movement to more formalizing an advisory committee. And again, I think that's something that HCI we've done well, and we have some successful patterns and practices around that. Some of you have been involved in the HPD advisory committee. We feel like that committee specifically has brought us a lot of success, and we have a number of others. So we'll look forward to sort of remaking that work and sort of continuing the engagement in that frame. The only update I would share with you before we move into the agenda is, and just kind of really emphasize the value of integrating data exchange framework program into the HCI portfolio, is our state of California application to the Rural Health Transformation Program, which is a CMS cooperative agreement program you're probably all aware of, generated out of HR 1. But we quickly assembled to work on that application. Jacob and team and the data exchange framework expertise brought to bear was part of that. So if you've seen it, we have kind of a overview of the application. It reflects essentially 3 legs, including workforce development, technology and tools, which can absolutely encompass and include advancing participation in the data exchange framework with technology investments. And then the third really is the key piece that workforce and technology will both support, is a transformative care model. Essentially, you're looking to develop regional hub and spoke models to bring all of the care needed to rural communities by working across rural providers, hospitals, clinics, and the like. So again, immediately sort of benefiting our work, our programmatic interests at HCI, and just wanted to reflect, share that with you. It's part of our excitement. We look forward to hearing from CMS by the end of the year, and then hopefully those are updates we'll be able to share in the future as we stand up the next phase of public advisory committee, and look forward to continue involvement from all of you. So again, with my thanks and appreciation, very glad to be with you, and I'll hand it back over to Jacob to move forward with the agenda.
Thank you, Scott and Akira. Perfect. Thank you for bringing the slides back up. As Scott said, there are a lot of opportunities for us to build some momentum heading into 2026 for the data exchange framework. So, Assembly Bill 133 this sparked the data exchange framework, and now Senate Bill 660, rural health transformation. A number of things are coming that can continue to help us move forward exchange in the state. And Senate Bill 660, I believe, is actually signaling us and pushes us to move forward in transparency, in governance, and accountability. And as we start to implement Senate Bill 660 and prepare for the next phase of the data exchange framework, we really do remain committed to that vision that we had shared on the last slide. But I want to take the opportunity to introduce Mike Valley, our Deputy Director and CIO here at HCI, to start talking about how 660 is pushing us towards the future of exchange in the state. Mike.
All right. Thank you, Jacob. Good morning, committee members. Again, Michael Valley, HCI Deputy Director. I just also want to take the opportunity to thank this committee for their contributions. And I also want to acknowledge Jacob Parkinson and the entire civil service team for the fantastic work that they've done and their many accomplishments in getting this program to the state that it is now, and is well positioned to continue to evolve to meet the goals of data exchange. If you go to the next slide briefly, I'll give a short overview of Senate Bill 660, much more to come, but just by way of background for today, as you surely know, on October 8th, Governor Gavin Newsom signed Senate Bill 660 into law, which expands the data exchange framework in several ways, including by codifying HCI's role as administrator of the DXF program, clarifying definitions for physician organizations, requiring emergency medical services to execute the data sharing agreement, and adding several accountability and transparency measures, such as making data sharing a requirement for contracting with public payers like DHCS, requiring HCI to publish a list of required signatories that may be out of compliance with the data sharing agreement for transparency, and allowing HCI to refer non-compliant entities to their relevant state licensing agencies like DMHC or CDPH. I feel like these requirements represent a strong statement from the California legislature that data exchange is important. It's important to the health and well-being of the people of our state, and that the mission of the DXF should continue with this new direction and new focus. Certainly a lot to unpack here. All of this will require strong stakeholder collaboration and input, and from across all sectors of health and social services. And so the law also appropriately makes changes to the stakeholder governance structure of the DXF by updating provisions related to the advisory committee and making the HCI director responsible for appointing members to that body. And so for this reason, HCI will reconstitute a new stakeholder group and formally appoint new members to that body. The new committee will be responsible for advising the department on policies and procedures, much as this group has been. And in addition, we'll need to make specific recommendations to HCI about issues such as the need for technical assistance and grant programs, new entities that should be added as required signatories to the data sharing agreement, the need for other governance frameworks and enforcement procedures, issues related to the collection of individual level demographic and health related social needs data, among several other topics. And I would expect that each of these items on the screen to be further discussed and deliberated by that new committee in the public forum, which will be incredibly important to assist HCI and our sibling California Health and Human Services Department. So I expect to be highly engaged in the public process for how to implement all of these requirements. We expect to convene the new committee in the first part of 2026. And that body will continue on. It'll be an ongoing committee and will continue to oversee the administration of the DXF program. So please do stay in touch. Please do share any feedback that you have. Would expect everyone here to continue to have an important voice in helping to make sure that this project is successful. We have attached with your materials for today the fact sheet that outlines Senate Bill 660 implementation at a high level. So please do share that with your networks, and expect much more can be communicated soon about specific implementation steps the department will take, and as the new advisory committee begins their work. So I'll just close by again expressing gratitude and appreciation to this group, all committee members, interested parties, and staff. It's been great joy to get to know many of you over these past months. So thank you for your service. Much more to come, and happy to hear any initial reactions to this, or answer any questions that I can.
I think we can keep moving unless folks have questions. Akira, if you can take us to the next slide.
Jacob, you have a question from Felix.
Great. Felix.
Can't hear you, Felix. You must be double muted.
No problem, Felix. Feel free to interrupt us at any time here. Akira, if you could take us to the next slide. So we're going to take a step back from looking ahead, looking to the future, and talk about some of the work that we're actively doing now. And we're going to dive into some of the details of our upcoming policy and procedure amendments. Before we do, I just want to say that you all have played a pivotal role in helping us move forward a number of amendments to our policies and procedures over the years. This is no exception here. And we've heard you. We've loved the engagement from this group, from our other committees, the Technical Advisory Committee, the standards bodies, and we're looking forward to continue pushing this amendment forward. Rim, I'll pass it to you.
Thank you, Jacob. And again, I want to thank everybody in helping us move this P&P forward. We've discussed this important P&P a number of times across a number of our meetings, and I just wanted to summarize today where we are and how this is most likely going to move forward. At our last meeting, we discussed two particular topics that raised a lot of questions during public comment, and we sought some more feedback from the IAC in our last meeting. The first was on requiring event notifications from skilled nursing facilities. And I would say that there was a fair amount of agreement that the notifications of admissions and discharges from skilled nursing facilities are really, really critical to care coordination, especially through transitions of care from the hospital or acute setting to a subacute setting. And many of our stakeholders have expressed support for requiring skilled nursing facilities that have the capability to send notifications of admissions and discharges from their facilities. However, what we also heard during that meeting, many of the skilled nursing facilities today don't have electronic health records, have not been part of the incentive program the way other providers have been, and a number of the skilled nursing facilities that do have EHRs, it's unclear what capability they have to send admissions and discharges. In general, I think that there was a strong opinion that January 1st, 2027 may be too soon for skilled nursing facilities to participate in notifications of admissions and discharges, especially those skilled nursing facilities that don't have EHR capabilities today. We really heard your feedback during the meetings and public comment, and we are currently continuing to evaluate the recommendations that we heard from you in order to move an amendment to the P&P forward. We also discussed human readable notifications. What we heard at the meeting is that the lack of a current requirement for providing notifications that are easily read and understood by a human is not an issue for most DXF participants today, that some QHOs provide the capability of human readable notifications while others do not. That does mean that many participants that need help in understanding and consuming notifications can get that support through QHIOs. And we also heard that there was a significant burden if we would move forward requirement to provide human readable notifications. So our intent is not to require human readable notifications in an amendment to this P&P, while we would retain requirements and additional specifications around machine readable notifications. Kara, if you want to move us on to the next slide. So as a summary, we are not publishing an amendment to this P&P at this time, but expect one in early 2026. And in general, what you see on this slide is what you should expect to find in that amendment. That, as we discussed before, we'll be removing the specifications of technical standards for nationwide networks and frameworks, since those organizations already establish those specifications, but we will clarify in the P&P that nationwide networks and frameworks can still be used to meet some or all of an organization's obligations under the DXF. We are transitioning, we're making several changes to event notification, including transitioning the language away from notifications of ADT events to a more generalized event notification, defining a number of new terms. You saw the definitions of those new terms in the copy distributed for public comment. However, we are still retaining as requirements only event notifications associated with admissions and discharges to hospitals, emergency departments, and potentially to skilled nursing facilities. We are establishing standards. We would be establishing standards around the content requirements for event notifications. Again, you saw a list of those in public comment, and we discussed those at our last meeting. It would include using HL7 V2 ADT messages as the machine readable standard. And as we've already discussed, we would not be including a human readable specification. And then formalizing the definition of rosters as a mechanism to request notifications and the content of those rosters. We also propose to clarify the language associated with use of sex or gender-related person attributes for person matching, while clarifying that it's still permissible to exchange that data, just not for use in person matching. And then added, or considering adding a number of legal clarification of legal requirements around the needs for BAAs, and legal and compliance accountability as suggested in public comment. Again, our expectation would be to publish a full amendment early in 2026, and in compliance with our P&Ps, the effective date for any of the new requirements in that P&P would be at least 180 days after publication of the P&P. Let me pause there and see if there are any questions on any of that. Yes, Scott.
Yeah, I'm still not fully understanding about the prohibition of sex and gender attributes. Is that just to protect patient matching for trans patients, or is there some other rationale for that?
That was it. It was at least in part the recommendation when this was discussed for the strategy for digital identities back in 2023, and part of the discussion here as well, that the value of gender in person matching is low, and therefore the unintentional disclosure of information about gender affirming care or something akin to that might be disclosed through person matching, and therefore it should be prohibited for that purpose. We clarify in the P&P that there are some technical standards that absolutely require it, and this is not a prohibition to use it in those standards that do require it. We still need to be compliant with the standards that we must be using. So it's still permissible for those, but when it's not required in a standard, it should not be used.
Okay, because clinically that can be very important information that clinicians
can-
need, but just
yes.
for matching, that makes sense now.
Just for matching, and that's something that we'll try to make sure is clear in the P&P as well, is that it is not a prohibition for exchanging that information. USCDI still includes that information,
Yeah.
along with gender identity and other related fields, and it's not a prohibition to exchange that just for person matching. Thanks for bringing that up, Scott.
Yeah. Okay.
Are there any
That's
other
clear.
questions? Seeing none, Jacob, I think it's on to you for the next slide.
Great. And before I jump in, Felix, can we hear you yet? Do you want to ask your question regarding Senate Bill 660?
Yes, thank you, Jacob. And apologies for the unintended silence on my end. Well, first of all, I wanted to reciprocate all the gratitude that the team expressed and right back at you guys. I know it is a heroic feat to inherit something as daunting and as important as the data exchange framework over the course of less than half a year thus far. And I think you guys have done an outstanding job in terms of carrying the baton. For the next steps with the reconstitution of the stakeholder committee for SB 660, I wanted to ask Mike or Jacob or whomever can speak to this. I assume there's going to be a process for soliciting applications or expressions of interest to be on the committee, and if so, when can we expect to see that go out?
Felix, thanks for the question. So yeah, just to reiterate, the HCI director has authority to
Okay.
select members. Historically, HCI's had a lot of success working through trade associations and other industry groups in order to identify members. So hasn't been determined yet, but if you or others want to share recommendations for how the director should consider her approach, I'd be happy to relay that to her.
Thank you. I think that's very helpful. Thank you, Mike.
Thank you.
Great. Thanks, Felix. So I'll take us. We are making other policy and procedure amendments this calendar year to align with Senate Bill 660. So just to briefly talk about what those amendments will look like, we are effectively making 3 categories of changes to our policies and procedures and impacting 5 separate policies and procedures in this change. The first thing we will be doing in order to align with the new legislation is to add gender affirming care, immigration, or citizenship status and place of birth to the categories of information that will not be required to be exchanged under the DXF. They will still be permitted to be exchanged, but they will not be mandated in our policies and procedures. We will be adding the July 1st, 2026 deadline for emergency medical services and physician organizations and medical groups to the requirement to exchange health and social service information, P&P. We will also be reflecting the options to delay exchange until July 1st, 2026 for EMS and medical foundations, and January 31st, 2029 for the Department of State Hospitals and Department of Developmental facilities that utilize seclusion or behavioral restraints in our participant directory and requirement to exchange health and social service information, P&P. So just to say, minor amendments, but substantive amendments that are going to be made to our P&Ps to align with the new legislation. And we're going to host a brief public comment period to solicit feedback on these changes. We expect to start that public comment next week, and we welcome this group's feedback on the changes we intend to make. And we'll be sending out notifications. So if you are not on our listserv already, please do reach out to dxf@hki.ca.gov. Get on our listserv so you can be notified of changes like this as they come down the pipeline. With that, I'm going to pass it to Cindy Barrow to start discussing DXF impact measurement and how far we've come under the data exchange framework thus far. So Cindy, I'll pass it to you.
Thank you, Jacob. So in preparation for this meeting, I started looking back at the first time we started talking about impact measurement. And you may recall it was more than 2 years ago when we recognized that we were taking on some very ambitious goals, and we needed to find a way to track our progress and see how we're doing and guide us along the way. And it was that first conversation with you all that sort of set the stage for what is now the DXF impact measurement efforts. And I want to thank you for that initial and the ongoing guidance that you've provided over the last couple of years. I wanted to give you some updates and also a little bit of a retrospective on some of the numbers. So if we can move to the next slide. I went back to the very early days and to look at the number of participants and to plot out the growth we've seen in participants over that period of time. I think my reflection on these numbers is it's been nice, steady growth, you know, a little bit of leveling off in early 2025, but you'll notice the last bar here and the labeling on the x-axis is really not even a full quarter, and we've seen another little bit of an uptick in the number of participants that have signed the DSA. I think I might attribute this to SB 660 and sort of a greater awareness of data exchange that came with that. But I think that is indication that we have not only achieved much looking backward, but have much more to achieve as we look forward. So great progress and more to come. On the next slide, I think we try to illustrate the breadth of organizations that have signed the DSA and are participating in data exchange. We're, as I noted earlier, we're 4,700 participants. Every sort of segment of the health and social services environment is included. Particularly want to call out ambulatory care. I think we all know that there are a lot of ambulatory care organizations around and in our communities, and the uptake there has been strong. Again, good participation across all segments. The next slide sort of switches gears and not looking at the number of participants really, but the number that have completed the participant directory and shared with us how they are going to be exchanging. That has continued to grow. We would love to get this number to 100%. It will, I think, driven by some of the aspects of SB 660 and driven by upcoming delay dates for people that delayed exchange. I think we will see these numbers continue to rise, and a lot of good work is going on to reach out to participants and also to work with other departments to help get the message out about putting your selections in the participant directory so that we can start to affect the data exchange. One of the most important ways that we support data exchange is through the QHIO program. So if we can move to the next slide. This is also an area where your guidance has been really helpful as we developed the application in 2023, kicked off the program late in that year and have been working with the 9 qualified HIOs since then. It's been a very successful program and has provided a lot of support to the participants who need a little assistance in meeting their obligations. We recognize through this participant directory today, we have roughly 2/3 of the participants are using the services of a QHIO. The one figure that really stuck out to me as I looked at some of the data was in the last 15 months, the number of organizations that are using a QHIO services for event notification has doubled, more than doubled. And so that just again drives home that for many organizations, this QHIO program is essential to helping them meet their data exchange obligations. And so I want to recognize that through this data, but also thank you at the same time for helping to guide the development of the QHIO program and the application process and all of the services that surround that. And also, as much as I love numbers, I also like words, and I want to call your attention to the quote at the bottom of this slide, and in particular one word in there, the word instrumental. And this is an organization that is participating in the data exchange framework using QHIO services and refers to it as being instrumental to their ability to exchange data and provide great service to their clients and patients. So again, calling out the QHIO program as one of the many successes of the data exchange framework. I'd also want to call out another programmatic area that's been very strong and has benefited from your guidance, which is the grants program. If we could switch to the next slide. As you all recall, the grants program has done a lot to get the word out, starting with the educational initiative grant program back in 2023. This program, through 8 not-for-profit organizations and associations, helped to get the word out and help to organizations to understand what the data exchange framework is, how they participate, and through their seminars, sessions, speakers bureaus, learning collaboratives, et cetera, they reached a lot of people to get the word out. So the guidance you provided in the design and implementation of that grant program was tremendous. And we continue today in the other half of the grant program, which is the signatory grants. These are the technical assistance and QHIO onboarding grants that organizations that needed a little assistance to get ready for data exchange were able to access to help them prepare. And as you see in the graph here, we are making a lot of great progress. Half of those organizations have completed both of the milestones required that indicate that they are ready to exchange data and have started exchanging, and the others are in progress, but getting there, and they will do so in 2026 as part of the grant program. So in summary, a lot of great progress over the last few years, much of it, driven by the guidance and support of this committee. And so I thank you for that. And also a lot to come. I'm looking forward to the next phases and some of the opportunities we have ahead of us. So again, thank you all, and I will turn it back to Jacob.
Thank you, Cindy. And we did have a question in the chat from Scott. Do we have denominators for our participants to know how compliant we are as a state? And I'll just answer that briefly. Senate Bill 660 gives us the authority and actually signals and mandates that we begin determining who is required to sign the data sharing agreement. And in January of 2027, we will actually be publicly listing a list of all of the participants that are required to sign the data sharing agreement and which of them have signed, which of them are compliant. So we expect to start doing more work with denominators in the coming calendar year, Scott. But no, it is not something that we have historically done to date.
And I would add, like, some categories denominators are easier to come by than others, but we will definitely be taking a harder look at that in 2026.
That's right. Okay. We can go to the next slide. And I believe it is time to take us to public comment. Akira.
All right. Thank you, Jacob. Members of the public must raise their hand, and Zoom facilitators will unmute each member of the public to share comments. If you logged in via Zoom, press raise hand at the bottom of the screen. If selected to share your comment, you will receive a request to unmute, and please ensure you accept before speaking. If you dialed in by phone, press 9 to raise your hand and listen for your phone number to be called. If selected to share your comment, please ensure you are unmuted on your phone by pressing 6. People will be called in the order in which their hands are raised, and you will be given 2 minutes. Please state your name and organizational affiliation when you begin.
Do we have any hands raised, Akira?
No, we do not yet, Jacob.
Okay, we'll give everyone 1 more minute.
All right. We still do not have no hands raised at this time, Jacob.
Okay, thank you, Akira. We can formally close out public comment then and head to the next slide. So thank you all. This is, like I mentioned, our final convening of the Implementation Advisory Committee, but we will be constituting additional governance bodies in the coming year to continue to help drive us forward. And I want to thank you again for all of your dedication and your commitment, joining us for some long meetings over the years to help us drive a number of things forward. So thank you, and we look forward to your engagement in 2026 and beyond. Just to close out with where we are at, we are a framework with 4,700 participants now, and to date we have lacked many accountability mechanisms. But as we look into 2026, there is a real opportunity to build on momentum, to start building accountability and transparency, to build on our current governance model. And I'm really looking forward to doing that, both with the team that we have here built on the data exchange framework, but with all of you as stakeholders. So thank you all again for all of your commitments and all of your contributions. And please do stay in touch throughout next year. We can go to the next slide. As always, you can find our resources on our new revamped DXF webpage. So as we send out the slides, please do take a look if you haven't looked at our new webpage and see everything that we have shared and published there. But otherwise, I'll give everyone 15 minutes back here, and thank you all for joining us today.